Hello and welcome to all of you. My name is Eytan Lerner. I'm a Feldenkrais method practitioner, also a neuromovement Anat-Maniel method practitioner, working with kids and adults with neurological difficulties and challenges around the world. And I'm here to present today the first out of 3 presentations that actually I would like you to relate to them as a whole. Following my presentation will be my colleagues from the Moving Center that we formed and established together. They will present case studies, but I will present here the intro and also a brief experiential process, neuromovement process, so that you can have some background, felt sense background to what you're going to watch later. So before I start, I just want to talk a little bit about the how we're going to do the next session or lesson. I urge you to relate to your sense of comfortability before anything else. First of all, go within the borders of what's comfortable for you. We're going to be dealing with the connection now of the eyes and your attention, your eyes movement, and the rest of the body, and how it affects each other in a reciprocal way. You will be able to notice maybe later after the session that we were actually choosing the case studies and the lesson, a connection between them. So please pay attention to a few strategies that we're using. One of them is slowing down. If we want anything to change anything with the vision, with the way you function, doesn't matter what, in any walk of life or area, then slowing down gets the brain to really start firing and creating new connections rapidly and very profoundly. So pay attention to that, slow down. I'm going to use very gentle movement, very small, minute movement, and I will work especially and deliberately working only on one side of your functioning toward one side of your body, so you can detect differences between one side and the other throughout the lesson at the end of it. So let's jump right into it. This is not going to be a movement lesson, even if we are using movement, but again, we're using attention and the movement as a vehicle to create new changes. So it's a mean to an end, the movement. So go easy. Just stand up for a second. So just feel the first impression and sensation of how you're just standing. Let your hands be really hanged loosely and feel how you feel yourself on the floor. Are you tense? Relaxed? Maybe there are parts of you that are relaxed and parts that are tensed and stressed. Is it possible to detect and distinct between them? And feel how you're holding your chest. Do you hold your chest? Do you hold your shoulder? Or you're completely surrounding to gravity? How's your skeleton in gravity? And take a long moment to just move your attention to your face. What's the overall sensation? Are they stressed? Do you feel the wrinkles? Is it comfortable? It's like around the mouth, the muscles of the cheek and the jaw. What's the sensation around your eyes? Are they stressed? Maybe if you compare one side of the face to the other, do you feel any differences between the right eye, say, to the next eye? Maybe one is working more stressed, maybe one is more at ease and soft. How about the rest of if you feel that one eye is maybe softer, this side of the face also soft, or it's not connected? Please go ahead and sit down and lean against the chair. comfortably. By the way, if you have wearing glasses and you feel comfortable with it, I would ask you if you can just put them aside, if it's possible. And just close your eyes and sense the way you are feeling your body, your back against the chair, your buttocks and your pelvis and your thighs against the seat, and your feet against the floor. Can you tell any differences from right to left in the way that you're, let's say, for example, if you're leaning toward one side more than the other? And don't try to correct and fix anything. Again, remember, we're not dealing with movement per se for the sake of movement, but as a vehicle, as an engine to wake up the brain, to get more connections and start functioning better and learn. So now, open your eyes and go, if you can, just slide yourself to the edge of the chair so you can feel your sitting bones are sitting and you're not leaning against the chair. Unless you feel you have something that is bothering you, if it's not really comfortable, you can do the lesson also when you're sitting fully against the chair. Okay, but if you can, slide forward. And now we'll just start looking to the right a few times, slow down. Without the attempt to see anything specially, but see if you can just start slowly feel, how do you use your eyes? Are you brushing off all the trajectory that they are doing over the room, or they jump, skip parts of the trajectory? Are they fluent? Maybe you're holding your breath. If you are, can you let it go and choose a movement maybe smaller, gentler, that you can really feel that is? And go back to the middle. And now just take your left hand, put it on your shoulder, on your right shoulder. And please take your right hand and support your elbow with your right hand, the left elbow with your right hand. And you can let both the hand and the elbow be supported on your chest if it's possible. The idea now is to get the left hand as passive as possible. But using that, start again turning to the right. But whenever you turn to the right, gently, with the right hand, with the help of the right hand, you just, it's as if you want to caress with the left hand, caress your shoulder blade, not forcefully, and see if you can connect it to the movement of turning to the right. Don't try anything special, just do it gently. And already see if this movement is creating more of an opportunity for you to move fully or participate fully with your whole body to the right. And maybe you're even looking a little more to the right than before, farther away. Relax your shoulders, relax your face. And come back to the middle and just rest. Put your hands on your laps or on your knees and just rest for a second. Go back to do the same thing. Put your hands as before. And now, see if you can start slowly moving your trunk, your shoulder blade with the help of your hand to the right, but at the same time, start looking to the left with your face and your eyes. Like you want to look over the shoulder that is coming forward. Again, do it really gently. It's not about doing more, it's about doing less. We do less, we can sense more. We're lowering the stimuli, we have more information and more minute information that it's really, this is the food the brain, which is a big information system, really needs in order to change. So do it just 4 or 5 times slowly, gently. And the next time you're going to the middle, turn again to the right with everything and see if it's changed. Move yourself to the right and your gaze and your eyes and your face. See if it's changed. Go back to the middle. Rest for a second. Just feel how you're sitting on a chair now. If you can close your eyes, maybe your brain already got enough information to create and detect differences between the left side. For example, how do you lean through the sitting bones, through the left sitting bones? Do you feel any differences? Are you leaning toward one side or the other? Or maybe do you feel other differences that you can distinguish between the two sides? Maybe your face, maybe your eyes. And just again, put your left hand on your right shoulder and support with the right hand the left elbow. Now, if you can, just close your right eye, if it's possible. If not, if you cannot do it, just put the hand that is on the shoulder, just put it on your, cover your eye, your right eye, which is also okay. And like this, start moving to the right and see how the left eye is moving and make it relaxed as possible. Don't try to see anything specially. Don't strive to get anywhere. Just feel how you do it, how you move, how you're using one eye. Does it change the turning? And next time, go back to the middle, rest for a second. Let your hands down. And just, without thinking too much, turn to the right as if somebody is calling you. Feel how you do it and where your eyes are now. When they're going to the right, are they going maybe farther away or maybe more fluently, or maybe both? Maybe it's also that it's farther away and also the quality is different. And now look to the left and see if it's different. And don't try to make it like the right. See what are the differences? Do you feel any sensation of difference? But this was, and go back to the middle and just let it all go. Usually we do much more elaborated sessions, but I hope that you could feel with just few minutes, you can feel changes. As I said before in the introduction, when you watch the next presentation, the case studies, the videos, just see if you can have your experience in the background and see what the experience of the kid was. Maybe it will help you you realize more what we're doing. Thank you very much.
Hi, my name is Matty Wilkinson. I'm with the Moving Center. I'm a Feldenkrais method and a Nathaniel method practitioner. And I'm going to present part 2 of our series of 3 talks called Moving to See, the relationship between movement, awareness, and vision in children with neurological challenges. And this part is called David's Story, Remapping After Traumatic Brain Injury. This is David. At 2.5 months old, David had a severe traumatic brain injury with a subsequent stroke. And these both affected the right side of his brain. So the left side of his body in terms of movement, sensation were affected, as well as his left visual field. When David was 5 months old, he came home from the rehab hospital, and his parents were encouraged to do tummy time with him and have him practice sitting. But David actually really hated being on his belly. He would cry and try to get out of the situation. And when he sat, he looked uncomfortable. His back was rounded, his legs were stiff, and they were concerned he wasn't ready for these milestones. So they connected with me. When I met David, I was really struck by these things his parents noticed, as well as the fact that he seemed irritable or almost fearful. I knew that the trauma to his brain had affected his map of himself and also his environment, and I wanted to support him in remapping himself and his environment. So here are some strategies that I used with David. You will notice they're similar to what Eytan used with you in the movement lesson. One is slowing down to help the brain create new connections. We intentionally reduce the force and move with attention so that we can sense greater detail and begin to develop new pathways. We use variations to allow us to sense differences. And the variety is important for filling in the details and refining the maps. Mapping movement happens within the visual and auditory space, and it's the interconnection and the relationship between these streams of information that support and move the process along. We also use a developmental model. It means rather than trying to accelerate and skip to the next milestone, you could say, we look at what are the fundamental pieces that need to be in place for the child to discover that milestone on their own. So for instance, learning to stand, before a child stands, they have many earlier experiences using their foot against the floor, like he is here, that helps refine the map and the sense of how they can use that part of themselves to generate movement and support from the ground. So the videos you'll see, they start when David was already quite interested and enthusiastic, actually, about being on his belly. I don't have video of that earlier phase, but the quality of that process of him learning to achieve that milestone on his own was very similar and utilized the same strategies that you'll see in these videos. So here you can see I start by taking off his pants so he can have bare legs and ankles. He can feel with more refinement, more clarity, his legs, his knees. And I'm taking time. I'm not rushing him. I'm not trying to get him to do something that he's not yet able to do. I want him to feel himself and clarify the feeling of his spine there. I touch his pelvis as well. And filling in these details for him so he can begin to refine his map, his sense of his legs, his pelvis, his back, in this relatively new situation of being on his belly. Of course, on his belly, he can't see his legs. So it's a new situation in which he can refine his sense of that part of himself. In the kicking, he's feeling the weight, the sound actually, and the impact and the sensation of his legs against the table. And this is all helping him to refine and develop the map of this part of himself in this situation of being on the belly. Here I have this little squeaky orange cube, and you'll see that playing with him, he's come away from the table a bit more. He's got his hands together, which I'll talk about again in another clip. But I'm playing with variety, right? I'm doing it softly, abruptly, kind of gradually, getting him interested. Well, he is interested. He's curious. But this is all happening on the right side of his visual field, which is more available to him. But I bring the toy over to the middle, the midline, and even a little bit across, touch his left hand. He's interested, but he shifts his weight back over, perhaps to orient from his right visual field. And I'm not interested in get him to practice something he can't yet do. I'd rather build, again, those fundamental pieces that he needs to orient and discover that part of himself. Here, he's resting, and when a child like David feels the urge to rest, I want him to rest, because I know that sensing himself and the attuning to those sensations, those experiences, are part of refining how he feels himself and understands what he can do, actually, and senses what he can do. There, I pulled up his sleeves so he can feel his elbows and his forearms against the mat, and he begins to use the mat and the ground to pull himself towards this block. I'm touching his chest, and he lifts his chest actually away from the floor, but you can see his hands are together, which I'll talk about in the next slide, how I deal with that. In this slide, you'll see he comes up onto his hands and knees, but his hands are quite far from his knees. The distance is long, you could say. And his hands are, again, touching one another. They're not separated. But rather than imposing or trying to correct him, I'd rather create the conditions for him to feel what works, what's comfortable for him, and what's more functional. So he comes down. He's in a developmentally less challenging situation. His weight is supported by the table. And just taking time to feel his chest, the weight shifting a little to the left and to the right, distinguishing for himself these two sides of himself that he can lean one way and the other. And he shifts and he comes back up onto hands and knees, and you'll see there he brings his hands closer to his knees. And again, him generating it and feeling it, I think, is an important part of the process. He pushes up. He's creating a lot of variety, and I'm following and allowing that. And the variety helps him discover something new. Here he's separated his hands on his own, and he's really shifting the weight between one leg and the other, a little more towards his left hand or his right. And really giving him time to discover those possibilities. And again, he begins to lift his knee. I don't know where he's going, but I'm curious, and I follow, and that's actually the pathway that he used to learn to come to sit initially. And the process for him to map this connection between being on his belly, coming up, and then coming to sit is important for him to feel secure and really confident in that situation of sitting, so that he knows where he is, he knows how he got there, and if he wants to get back down, he knows the pathway for that as well. So here, David is, again, in a developmentally less demanding situation. His weight is resting on the table. And in that condition, he can really clarify and sense himself with a greater refinement. Here I'm shifting the weight over one forearm, one hand, and the other, pushing through, feeling the two sides of himself. So he can map for himself that he has two hands and two arms, and they connect to his back and his shoulder blades, and that he can use them and sense them distinctly from one another. Really sensing the difference between the right and the left. You can see he comes up then and really leaning now, shifting his weight over one knee and then the other, and actually reaching with his left hand to advance himself on the table towards the apple. I start to play again. I'm using sound, little trying to interest him in coming, shifting his weight and coming this way and that way, feeling the variety, the richness, and filling in his sense of himself in this situation, which is different, right? Being on this one knee and one foot, two hands. One thing I'm looking to clarify for David in the map of himself is how he uses and senses his spine, the musculature along his back, to lift his head, to balance and counterbalance actually the weight of his pelvis in space, and that this relationship, this fundamental connection between his back, his head, and his pelvis is really central to his organizing himself in these new emerging developmental situations. And again, there's a lot of variety in that process. It's not a linear, straightforward thing, but I want for him to find and feel and sense that he can mobilize his back to lift, to orient, and to take in the space around him. Here, David's come to sitting in a variety of ways. I bring this block over to his left side. He touches it briefly, but maybe doesn't see it, doesn't notice it. And I don't force the issue. I'm curious and interested in him in discovering that for himself. And right there, he actually accidentally puts his elbow in my hand. It would be very easy for me to take his hand and touch the block and say, feel the block. But I'd rather him feel it for himself and discover it for himself. So I'm waiting, and he turns and discovers, comes into contact with it. And you see his father nodding his head in celebration of this moment of discovery, of really finding some object that he wants, right, the block on the left side, and being able to orient himself and access that part of the space around him. Here again, he's come to sitting in a variety of ways, and he can lean. He's leaning on his right hand, and then he's touching the floor with his left fingers, looking curious. And I'm touching his pelvis so he can feel the foundation of his sitting, where he leans his weight to the left or the right. And really being interested in the whole space around him. There I'm scratching again, making a sound. He's interested on the left side. His right hand gets caught on his knee, but rather than correcting him, I wait for him to figure it out. And he brings his hand across so he can lean and follow my fingers in this on the left side, really accessing the full space around him beautifully. So David at 14 months is really curious and playful and focused. He moves with a refined quality, and he has this remarkable sense of orientation in space and access to the full space around him. He's also exploring new language sounds, and his parents, thankfully, are not rushing him to practice new milestones because they really realize how the quality of the process has been supported by actually giving him time to develop that clarity in the map of himself and his environment in order to achieve those things with independence and a sense of ownership, actually. You can see the beautiful crawling, the symmetry and elegance of that, and it's quite lovely to see. And this approach is based on an understanding of these fundamental conditions that our brains need in order to remap ourselves, the environment, our ability to perceive and interact with the environment, and move forward in the developmental learning process. Thanks for watching. We at the Moving Center look forward to hearing from you if you have questions. Andrea Hennen will have a talk now about another case study of another child that she worked with. I hope you check it out and look forward to talking to you in the panel discussion afterwards. Thank you.
Hello, I'm Andrea Hennen. I'm a member of the Moving Center. And just like my two colleagues before me, Eytan, Lerner, and Matty Wilkinson, I'm a Feldenkrais and Anat Baniel neuromovement practitioner. My part of today's presentation of our center is to show you a case study of Theo. He's 19 months old. This study is named Organizing the Eyes Through Movement. I'm going to guide you through a content, which is mapping the brain. I'm going to show you a first video of Theo. We're going to have a practical approach with a very brief neuromovement lesson. And I'm going to show you a second video of Theo and explain you some of how we work to make vision possible through movement and learn how to see. In the first picture of Theo, you see him, he's 19 months. He doesn't have a diagnosis. The picture is being taken before his lessons with me. His right eye is rolled up and there is no sign that he can see. He doesn't blink when you come close to his eyes. He lifts his legs up in the air in a non-intentional way, and he does not roll to the side. He mainly lied on his back, and he kept his head mostly turned to the left. The work I have done with him was mainly guiding his attention in a slow, gentle way of touching him on his shoulders, on his chest, and the movements leading through his whole body to his pelvis, so he could actually have feeling of how it would be if his body was turning to the left, to the right, in a very gentle way. The movements are done very slow, so that I can feel him following, being able to follow my intentions and feel that he is paying attention if I'm going slow and move along with him, so he can catch actually what I am doing. He can feel his body leaning to the side, he can feel the surface of the floor clearly, and he can make all the experiences that he couldn't make without my help. I will show you now a video of Theo, which was taken after the work with me. Talking about his movements and intention, you witness how he is making use of himself. He's looking with both eyes in the direction of his mom. He doesn't turn his eyes inward and upward anymore. He's rolling the head together with his eyes. He's pushing the floor. He's crossing the midline. He uses his chest and shoulders to roll towards the left. The changes are obvious that he is using his right leg in an intentional way to touch the ball, to find the ball, to play with it, and also his left foot. And as we are talking about eyes, how the eyes are organizing the movements of the head and neck, and therefore the rest of the body can follow. As you're watching, you may see that he's turning his head and his eyes together, as if he could see. You can see that he's stamping his foot. He's orienting clearly towards the ball. He turns his head. And there seems to be more connection in his actions. He has more orientation. He's turning clearly to the side and back. And he's trying. He's exploring himself in space. He's exploring where his foot is. He's exploring his leaning points on the floor. He's feeling the push and pull in his body to turn to his head to the side, through his chest. He has much more freedom to move and many more possibilities. You can see his eyes are a little more centered. They're not looking up in his forehead anymore. They seem to be more centered, coming in one line with the movements of his head and neck. Let's practice a movement lesson together. Make yourself comfortable on the chair and close your eyes. Measure the distance between the left eye and the left ear, and the right eye and the right ear. The distance between your left eye and your left shoulder, and the distance between your right eye and the right shoulder. Are they in any sense different in size, in length, in volume, in thickness? How does the space feel for your left side and for the right side in comparison? Feel and sense the distance of your left eye to your left hip, left side of the pelvis, and then compare with the right side of your hip and pelvis. Feel the distance between your left eye and your left foot. Can you feel and sense a length and sense the length, depth, and how far is it from your right eye to your right foot in sense of length and depth? Are they about the same or are they different from one and another? And get a sense of your feeling your left eye and like it being attached to your left knee, just as if there was an imaginary thread. And also attach your right eye to your right knee, somewhere on top where it's easy. Slowly let your left leg sink a little bit towards the inside, towards the midline, towards the right knee, without pushing or working hard, just leaning it and bringing it back up. Your foot is remain standing. Do the same thing with your right leg. Bring your right knee towards the inside and bring it back up again. And you can alternate a few times, bringing the left knee in, following it with your left eye, bringing it back up, and then taking the right knee towards the inside and following it with your right eye. Slowly continue like that. Feel if there are some differences. And then stop that and feel the left eye is connected with your left knee and the right eye is connected with your right knee. Let them, both knees come together, lean towards each other. And feel if you, when you're connected with your eyes, if you also bring your eyes closer together in a converging way. Can you feel how your eyes are attached to the movements of the knees if you're concentrating on it, attaching with an invisible thread? Can you feel your eyes participating in this movement? And if it doesn't happen for you, maybe you can make it happen for you. Can you send your eyes towards the midline and bring the knees together, bring the knees apart, following with the eyes. And then for a few times alternate again, bringing the right knee in, the left knee, And feel if you can follow the movements of your legs, of your knees, sinking inward in a more easy, more gentle way, without straining. And slowly let go of that and just rest. You can rest your back. And then slowly open your eyes. Get a sense of how you're looking when you just glaze somewhere. How's the space around you? How is your gaze? You have the distance between your left eye and your left ear, the right ear, the right eye and the right ear. You can close your eyes or open. Just feel if something has changed. Thank you very much. Seeing a second video of Theo after having his 10 lessons, and he's touching the ball with his left foot. He's turned towards that side. He came over to lie on this side by himself. You can see he's aiming with his left foot and looking with his left foot to the ball. He's clearly taking action. He's orienting towards that ball. And he's using his left leg to cross the midline. His arms and his head, his chest are following him. You can see how the movement in his ribs and chest are following the movement of the left leg crossing the midline. He's so attentive. He feels what he's doing. He plays, he goes away, he goes back and forth. He makes pauses. Clearly he made progress, and a huge progress is that he could cross the midline with his left leg and also use his whole self in the direction of the source of where he wants to go. This is the second picture of Theo after receiving 10 movement lessons from me. His right eye is focusing more towards where he hears the source of sound. He can turn his head easily now, brings his head and body in one movement to orient where he wants to go. He has better head control, and look at his face. He's now more present, more active in communication. He shows interest in communication, in communicating with his environment. You will be back for more lessons with me.
Thank you for listening. We hope that we were able to show you our genuine and different approach to brain mapping and neuroplasticity using movement with attention. We at the Moving Center work successfully with adults and children with neurological challenges around the world. And we are happy to answer any questions that you may have in the following panel. Thank you very much.